Good good evening, everybody. Welcome to tonight's webinar. It's Dr. Dave here. Before we get going, just one little part of housekeeping, and that is just to check you can actually hear me. So we've got a good number of attendees in tonight, which is just fantastic. Obviously, you're all sitting in the comfort of your own front rooms, presumably with a lovely big glass of wine in paw. Ready to do some learning. So don't expect anything too taxing on the grey material tonight. It's going to all be quite light-hearted, but good information. I think you're going to enjoy what I've got for you this evening. Now, before we get going, could one of you guys, I don't know if you've used this application before called Webinar Jam, but there's like a chat box which should be on the right hand of your screen at the bottom. If you can hear me, would you just do me a big favor and just send me a message in that chat box? So if I can do that, I can say hello in the chat box, and you guys should kind of get a message from me there. So if you can do something similar back and just let me know that you can actually hear me, then that would just be superb before we get going and save me from talking to a computer screen online without you actually hearing me, which would be supremely dull. So there's the chat box is live, and so yeah, if one of you guys want to be able to ping me back a message, you should see my messages saying hello there. As soon as you do that, we can get cracking. Hello, thank you, Gail, thank you, Jessica, very much appreciated. Okay, well, welcome everyone. Tonight's webinar is all about you guys have got old dogs, right? Okay, I'm kind of just interested tonight to know how many of you guys have got an old dog or an old cat, and you're here to learn something to help your pet stay happy, fit, healthy, keep us bringing the stride. So I'm getting lots of messages in the chat box, which is great. Good evening, Marika. I see Mrs. PFT is in the room, which is fantastic. So you're all here to learn something about old, we call them crusties nowadays. That's entirely due to Marika as well. And you know, one of the reasons I want to do this is because it's a really common question for me to get in my consult room. People asking me, you know, what I do, how do I keep my old dog well? Well, let's crack on and do that. And I'm hoping you can see my slides. Can you, again, I'm getting everyone messaging me, which is brilliant. This is really interactive and cool. I know you guys are not going to be a shy audience either. I know there's a ton of you from the PFT Facebook page, so it's great to see you here. I know, I know rather too well that you're all not shy at all. So please type your questions in that chat box as you go. Now, because I am doing this myself tonight, Jess unfortunately has got held up in the clinic, so it's me. You're just going to have to put up with me, I'm afraid. Because of that, I'm not going to be able to answer your questions as we go, but we will get to them at the end of the presentation. Okay, so let's crack on and let's keep going, and we'll see what we're here to learn. Okay, so firstly, I just wanted, those of you that don't know me, my name's Dr. Dave. I've been a vet for 15 years. I graduated from Glasgow Vet School. I worked for 10 years in London. I was head vet of an 18-vet hospital out there. And then I upped sticks and moved out to Sydney almost 5 years ago. And been enjoying it here since. Now, my first area of interest, and I guess my first love, is dentistry and keeping your pet's teeth clean, and you're going to find out why that is as we go through tonight's webinar. But you know, I do pretty much everything in the practice, from surgery to dentistry to imaging to everything. And I'm also, I'm not almost Scottish, I'm completely Scottish. But I am Scottish, so if any of you have a hard time understanding me, that's probably why. So yeah, no apologies for that. And if you do need an interpreter, then I believe Google does that sort of thing as well. So please bear with me with the Scottishness. Now, what we're going to cover are the 4 really common problems. And when I say really common, I mean like 80% of the reasons that old dogs seem to be slowing down when they come in my consult room. are covered by these 4 problems, okay? Which means that we're going to be able to pretty much make sure that your pet stays feeling happy and healthy if we just look at these issues. So there's going to be some things fall outside of it, of course they are. But if we just recognize and deal with these 4 areas, then this is a great way to keep your old dog or cat happy, healthy, and mobile, and pain-free. All of those things, okay? So what I want for you to be able to do by the end of this webinar, and by the way, this isn't going to be like some in-depth clinical webinar. I know that would bore you to tears, and it would probably bore me to tears as well. So we're not going to do that. Just going to go through how do you recognize the problems at home, why the problems happen. I'll tell you a couple of stories of things that I've seen from the practice as well. And then how do we get it or stop your pet losing its va-va-voom in the first instance, okay? So we want all these old crusties to keep their mojo, right? We want them to keep happy, healthy, and keep doing the things that you love doing with them, okay? And then finally, we'll talk about, okay, so if your pet is slowing down, well, what are the steps you need to do to move forward and to get past that, okay? And the main message I want you to take away from tonight's webinar is you really don't have to, like, accept that animals slow down when they hit a certain age, because it's just not true, okay? So this is like the question I get in my consult room all the time, okay? Or this is the conversation that happens, okay? So you'll bring your pet in and see me, and I'm sure vets get this. It's not just me, it happens all the time. And what happens is you come in, I'll go, hey, how are you? What's happening? Is everything good? And you'll go, yeah, everything's fine, everything's good. And then we'll go, okay, so what's going on? And the conversation next starts to get a little bit, that's where I think it goes off cue, because you go, well, yeah, everything's cool, but you know, they're getting old now, and this sometimes happens when they're 6 years of age, right? But it can happen at 7, 8, 9, and it always gets my attention. Whenever someone comes in the consultation room and says, they've slowed down, well, my ears prick up straight away, because, and well, here's why, okay? Pets at this age should not be slowing down. This is, I don't know if you've seen this before, this is like a graph for cats and for dogs. And you can see on the left-hand side, the columns, so age 1 through 25. Now, the oldest cat I've ever met, okay, was 27 years of age. And I was 24 years of age at the time when I met it, which is pretty incredible, hey? So when people walk in the consult room, and if you look down the bottom of this scale, where the age of the cat is 6, 7, or 8, well, just look at the column to the right-hand side. It means they're somewhere between 40 and 50. Okay, now certainly age 40, like I'm not that far off that now, and like I don't feel like I'm slowing down, you know. And if I ended up going to the doctor and the doctor's going, well, you know, you should really be thinking about slowing down now, well, I'd be like, I think I'd be thinking about getting a new doctor now. That's what I'd be thinking, okay? So, 40 years of age equivalent is not a time we should be expecting animals to slow down. And we just need to get that out of our mind, because I think that's something that we kind of assume is normal, okay? And it's not. And when you look at this graph, you think, okay, well, you know, we should probably be starting to accept this maybe when they get to 11, 12, or 13, right? Because that's sort of between 60 and 70. But even then, okay, it's still, I see this all the time. It's why I'm really passionate about working with older dogs. I see this all the time when animals come in and they have some treatment for something, then a week later, the clients come back and go, I don't know what you did, but my dog is like a puppy again, or my cat's a kitten again. And that's when they're like 14 or 15. So, animals, as we all know, do really well after things that would put us in bed for a week or 2 weeks or a month maybe, like surgeries. Cats and dogs are often up and at them after a couple of days. So they're tough. They're really tough. And they can put up with things better than we think they can put up with things, okay? So one of the reasons that I kind of not that I got into working with old animals, but certainly one of the reasons that I'm enjoying it and we're getting a lot of exposure to doing that in the practice, and a lot of the feedback that we get is coming from working with these guys. And I think I mentioned Pause for Thought Rescue because, number one, I think they do a great job showing how not easy. I know that Mrs. and Mr. PFT put an awful lot of their time and effort, and they've got this band of amazing supporters, both from online and people that help them do their jobs, but are really showing what a difference can be made by putting a bit of will, determination, and coordination into rescuing old dogs. And certainly one of the reasons I felt like doing this webinar would be good is because we're seeing so many old dogs and we're seeing the difference that doing work that other people decide not to do actually makes for these animals. So I would seriously, if you don't follow these guys already, they do a great thing, and if nothing else, it's quite a lot of heartwarming stories that come out of this. So that's a picture of me with one of the Pause for Thought rescue dogs, one of the absolutely divine little girls that we rehomed, and yeah, it's wonderful work. So look after these guys, and and that's why we call them crusties. Okay, so if you don't know me or you don't know anything about the practice, and you wonder why I'm calling these guys crusties, then that is why. Okay, I'm not being rude about old dogs. Okay, so let's get on with it, and let's start with the number one problem. Okay, rotten teeth. So this is by a million miles the most common disease that I see in the consultation room. And so when you walk in my consult room and you say, well, they're going okay, but they've started to slow down, the first place I'm going to look is in your cat or dog's mouth. And the statistics for dental disease are absolutely mind-blowing. I mean, you're talking about 80% of pets over the age of 3, okay? So we're not even close to crusties. We are like young adult animals, age 3, with painful dental disease. And that, to me, is just staggering. But it's true. This is the biggest, by far, of the 4 reasons I'm going to give you tonight. And I'll bet you that if you guys, and you guys are obviously going to have lots of older dogs, like this is going to be an issue for you. And what I would suggest you do is, and don't take my word for this, by the way, go on a site like PFT's site and see the difference. PFT, or Pause for Thought, by the way, the rescue site I was just talking about. But go on their Facebook page and look at the stories, the descriptions of the befores and afters, because it's, people have a hard time believing me, especially if I've met them for the first time. They'll come in and I'll go, your pet has an abscess, it's draining pus in its mouth and looks really bad, and it's poisoning them from the inside and out, and it's really sore. And sometimes people will go, oh my God, that's terrible. But a lot of times people will look at me like I've got 6 heads, or, I just offended their grandmother or something like that. I'm not making this up. This is absolutely true. And, I've just got stories after stories after story about, animals that this has made a profound difference to. And actually tonight, 5 minutes before I came on the webinar, I was just doing a discharge appointment for a dog, and it's just such a typical situation. The dog, beautiful little Italian Greyhound, and has got years worth of dental disease in its mouth. Now, I'm not going to use the word neglect, because we call dental disease the silent killer, and we call it that because it's conveniently tucked away underneath the lip, so you don't see it every day. They don't stop eating till they're in the biggest trouble, and so people are. I think it's fair enough that people think, well, I didn't know it was there, and I believe them. It's like there are clues there, and I'm going to tell you those clues right now, but they're there, and you don't want to be on the wrong end of having an old dog getting that dental where. So this dog today, I took 25 teeth out of its skull. 25 teeth, okay? And as a dentist, that's kind of soul destroying to have to do that, because our job's to save teeth. But as a dog's physician, I know that the reason that we're doing that is because those teeth are causing that dog literally agony. and that in 7 days' time, I'm going to have a dog come back in my consult room that has just rediscovered life, that just, just pain had become an everyday part of this dog's life. And in 7 days, once those wounds heal up, that dog's going to bound out and just be, step right out the front door and go, wow, the sky is bluer, the grass is greener, there's another dog I got to go chase. I've not felt like I can do that for years, and just have a different perspective on life completely. If dogs could talk to us, that's the kind of stuff they come back in and say. But what clients come back in and say to me, and so I had a Labrador I operated on, and this one stands out in my brain, will always live with me. Lovely black Labrador, and I have a bit of a soft spot for black Labradors as well as all the others. But this guy came in with this dog, and it had bones, and it was a tennis ball chewer, and it chewed stones, and it broken its teeth over years. Now, labs don't usually have that bad teeth. This one had an absolute shocker of a mouth. And so we booked it in and did the dental work, and we took out, I think, about 7 or 8 teeth from this dog. And the gentleman came back in 10 days after the dental, and he came in the consult room, and he looked really upset. And and as the vet, we're like, okay, what's the problem here? I'm thinking, this is not good. So I said, is everything okay? I mean, what's going on? He said, everything's great. I can't believe how good my dog is. It's like, but I'm being absolutely crushed here. And I said, well, what do you mean? And he said, I almost can't handle the guilt that I'm experiencing. And I went, well, what do you mean? He said, well, my dog it went to his basket and picked up, the old ropes that they get at the chew games. And I said, yeah. And he said he went and picked that, and he brought it to me, and he started to play a game he last played with me 5 years ago. 5 years. Now, you know how much dental pain hurts, right? If you've ever had a sore tooth or a toothache, you know how much it hurts. Now, imagine 7 of them in your skull for 5 years. That's what they feel in the before and after phase. That's why I get so excited when I see rotten teeth, and that's why I don't get in people's face about it, but I'm going to tell people how it is. That's why I do that, because those animals are in pain, and people will come back and go, well, they're still eating, so surely that's okay. I say, well, no, actually, because think of it in the wild. What happens when an animal stops eating, or an animal shows us a sign of weakness, right? Well, that's the equivalent of just painting this big target on their chest, okay? Or like putting up a "come and eat here" sign right above their heads. Tuck in, free food right here. That's showing weakness, which in the wild gets you dead pretty quick. Okay, so I think there is a primeval reason that they don't show that. And the other thing is that if a dog stops eating from dental pain, there's nowhere else to go. It's effectively giving up, saying, I would rather starve to death or dehydrate than put anything in my mouth. It's so sore. Okay? So how do you know if your pet's got dental disease? Okay? Well, it's really, really easy. Okay? And I want you just to do, and you can do this at home, and don't do it right away because you got to keep listening to me, but do this tonight. Okay? And I don't care whether you're listening to me in Sydney, or if you're in the US, or if you're in the UK, or wherever you're listening to this. The important thing isn't that you come and see me. The important thing is you recognize this as a problem, and you get something done about it by a vet who knows how to do dentistry, okay? So I call it sewer mouth, okay? So the first thing you do is just, if you cannot put your nose near your dog's mouth, take a big sniff without vomiting, then there's a problem, okay? And the little dog I treated today, that's why the client came in to see me. She said, I actually can't bear being in the same room as my dog anymore because the smell is so bad. So, have a look, have a smell for sewer mouth. That's the first thing. Number 2, you might have noticed a change in eating habits, okay? So usually they'll stop eating hard biscuits, or they'll stop eating maybe bones. And by the way, you shouldn't feed bones; they don't clean teeth. I'll talk more about that in a second. But they'll stop eating something hard, or they'll stop playing a game they used to play, like that Labrador. Okay, or they'll only eat their soft food. Or if it's a cat, then quite often they'll just lick the gravy, the jelly off the top of that mushy, horrible stuff. So that's a big clue. There's perhaps some pain in the mouth. Obviously, they do slow down because they're in pain, and because these are abscesses. This is pus. This is like, so if you could see the amount of infection on your dog's arm, for example, or under the skin, it would be this hulking, great big, huge, horrible abscess. And you'd get it treated in a heartbeat, okay? So because we don't, this infection is leaking into the bloodstream, and it's affecting the immune system, it's affecting the kidneys, the liver, the brain, everything. You know, there's nothing I've not seen get better, from seizures, believe it or not, to kidney disease, to appetite, to energy levels. All of these things get better after dealing with teeth. So usually they slow down, and that's why they slow down. Now, visually, what will you see? Well, brown teeth. Okay, teeth should be nice and pearly white. So if you see brown teeth, or you see red, or gums that bleed when you touch them, that's a problem. Okay, they should never do that. And the last one is, maybe your pet suddenly stopped letting you pat it on the head, or seemed to go head shy. So if you're seeing that sort of thing happening, then I would suggest there is like this huge, overwhelming likelihood that your pet has some dental disease. It may well have extreme dental pain, and that needs to be addressed pretty quickly. Now, the home care things that you want to do to prevent them won't work at this stage, okay? And there's a whole other webinar we did on dental disease. So I'm not going to talk about this for too much longer just now. But if you're interested, obviously the Killing Me Slowly webinar on vetsandpets.com.au is available, and I talk in much more detail about dental disease there. So go ahead and listen to that. But just recognize if you see those symptoms, then that needs action. And brushing is not going to help, and putting water additives or food additives is not going to help. Professional help is needed at that point. Okay. So that's dental disease, okay? And please type your questions in, or better still, in case, because there's a ton of conversation happening in the chat box right now, which is kind of cool, and it's lovely to have you guys interacting. So please keep doing that, and we'll get to those questions at the end. But if you've got a burning question, I'm going to get to those at the end, okay? So don't feel like I'm ignoring you right now, okay? Okay, so that's kind of number one, the biggest reason why pets slow down, and how to recognize those problems. Okay, so let's move on to the next biggest reason, and that's arthritis. Okay, so this is a picture of a dog's hip with really bad arthritis. Now, we're not going to get really any more into the technical detail of it than that, but I want to tell you a story about, actually, it's my own dog growing up as a kid. Okay, so we had, I grew up, my parents had a Papillon, believe it or not, which is exactly the breed of dog was in the last photo. And yeah, so I went to vet school. So I was 17 when I went to vet school, okay, and my parents, I think, when I went away, must have like decided they were going to start feeding the dog instead of feeding me. So this sort of 17-year-old eating machine just left home, and now they're comfort feeding the dog or something. Anyway, I came back, and the terms were 10 weeks, and the dog had gained, must have gained something like 3 or 4 kilos. Like, he was a haggis, like a pudding on legs, just belly on the floor. And I looked at him, I thought, oh my God, what happened to the dog? It's like we hit him with an edge ray, like a ray gun, just zapped him and made him like 10 years older. And I couldn't believe the difference in him. And so what we did then was, obviously, we put him on a weight management program, because, I mean, he literally was hobbling around like an old man. He struggled when he got out of his bed. He was really stiff, and he just hobbled like an old man. It was really upsetting to see, actually. So what what we did was we got him on a weight management program. So we put him on a diet, and he hated this diet. And I swear it was harder for us to get the weight off of him because he just looked at us with those eyes going, oh my God, not this stuff again. And I went away to university for another term, and when I came back, the dog was fitter than ever. And he was a little less weight than when I'd first gone away to university. And it was like the reverse aging effect had happened. And it just, like, I didn't need to be a vet. That was one of the most powerful lessons I actually learned my whole time at university, was just the impact that having that amount of weight added to them makes. And obesity, I mean, I'm not just talking a little bit of weight, but obesity is now being measured at around about 45% of the Australian dog population. That is really consistent with the US and the UK as well. And the reason, and you can chalk this up to both dentistry and arthritis, the reason this is happening is because of the food we're giving. Now, that's partially the diets we choose to give, but it's also portion control, people. We're just giving them too much food and not enough exercise. And I get it, we're busy and it's hard to take them for a walk. And hell, if you've got a cat, well, cats would more likely take us for a walk than we take them for a walk, right? But we give them too much food. And so, of course, the calorie equation's all wrong. Too many going in, not enough getting burned up equals fat dog or fat cat, okay? And it just pounds their joints. And this is, I mean, you dog owners, you will know if your dog has arthritis, okay? Because they'll do the same thing as cats, but you get the opportunity to see this more. And this goes with the heart disease as well, actually, because you take your dogs for a walk twice a day. Okay, whereas cats, well, cats sleep for like 23 and a half hours every day, and then they, mosey over to the cat biscuits and have a bit of a chew on the biscuits, and then, they'll run up to the scratching post, and then they'll headbutt you and, demand some attention, and then they'll nod off back to sleep, So it's kind of like, it's just one of those things in cats that unfortunately doesn't show up as obviously. And it's probably top of the list of the underdiagnosed conditions in cats completely. And that's a bit sad because we know cats and dogs experience pain the same we do. And again, if you have any arthritic joints, and I have a left knee that's a bit dodgy from playing rugby, and those of you that know me know, like, I am tiny, like 5'7" or something, and should never be playing rugby with all these giants. And so, that's how my knee came a cropper. But it doesn't matter how you ended up with a bit of arthritis. It hurts when it gets cold, and it hurts, if you overdo it or overstretch it. And you or I can do something about that. Well, in dogs it's more obvious. In cats it's pretty sad because it's much more subtle what you're looking for. Okay, so here's what you've got to look for. If you think, or if you have a pet that's slowing down, it's relating to arthritis, then number one, you're going to look for stiffness after they've had a good rest. Okay, so if in the morning when they get out of bed, or maybe they don't, maybe that's a subtle sign that you're going to look for is, my cat or dog always used to wake me up for breakfast. Now they take a bit of time getting going and they laze around in the basket for a little bit longer. And so that's the symptom. Right there is they're probably stiff and can't get out their baskets fast, and they take a little time to warm up. Well, that's probably arthritis, okay? Do they limp, okay? When they go for walks, do they have a limp at the start of the walk that eases off as they get going? Classic arthritis, okay? Sometimes dogs and cats will lick at joints, okay? I've seen this quite a lot on the wrist joints at the front. So if your dog, and you'll know this, and sometimes, okay, dogs lick all over and they groom, same with cats. The way you'll tell, this is easier with a dog with a white coat, often they'll lick so much they'll start getting big orangey telltale marks. Like people who smoke, lots of cigarettes have quite orange fingers. Well, this is kind of like that, just not smoking. So it's not like that at all. But it's kind of like this orangey kind of, you know, discoloration over the wrist joints. And it's caused by the saliva. There's staining in the saliva, and it's them licking and licking and licking. So that's a really a subtle one, again, that can tell you there's a problem with arthritis. They can cry, they can vocalize, they can whine a little bit more, okay? And some of them have swollen or disfigured joints, okay? So if the joints, if on one side, if an elbow joint looks weird compared to the other side, or if your dog limps or hops on one side and not the other side, then that's something that can be quite suspicious of arthritis, okay? And you're going to look for these problems more at this time of year, okay? So this is, you know, winter time is a pretty common time for dogs and cats to show up more with arthritis. So that's kind of arthritis, and that's the next most common one. So next one down is heart disease, okay? Now, heart disease after dentistry is probably my second, not favorite disease, because I don't think I have favorite diseases. That would be a bit weird. But it's certainly the disease I have a lot of experience treating and done a lot more training in cardiology and ultrasonography and X-rays and things like that. So I see quite a lot of heart disease as well, and it's again, it's a little easier to pick, but harder with cats again for the same reasons than the arthritis, because they just sleep all day. So, you know, dogs, what you're looking for here are, well, the first thing is breed, okay? So breeding is more important in heart disease than it is in arthritis or in dental disease. And you know, I know if a bunch of you guys are Chihuahua lovers out there tonight, and Chihuahuas are, you know, very common for us to see heart disease in aging Chihuahuas. But Cavalier, King Charles Spaniels are like top of the list by miles. But you've got to keep your eye out on boxers, golden retrievers, Dobermans, and a lot of any of the small white fluffy dogs like Bichons, Maltese, like we see heart disease so much. And I think probably it's very common here in Sydney because there is a big tendency towards either Bichon and Maltese crosses or King Charles Cavalier cross with poodles. So cavoodles, spoodles, oodles, any of the oodles, poodles get heart disease as well. So if your dog has an oodle, then this is something to be aware of, okay? Now, what you're looking for with heart disease isn't, you know, when they get very advanced, then maybe they start to have a cough and they don't want to get out of their bed. But it can be more subtle than that early doors, okay? And it's just a slowing down on exercise. That's the first thing that I think is the giveaway. So an old dog that starts to slow down, I think this is why it's so important. And I hope you're getting a picture at this point that multiple different things that could be starting to happen, and it's almost impossible over a telephone. Like you could start typing symptoms in the chat box for me right now, and I know a ton of you are doing that right now, okay? And the symptoms are really similar, hey? So I've said slowing down each time so far, not wanting to exercise as much. Well, you know, you're going to do that if you've got pain in your mouth, pain in your joints, or your heart can no longer basically your heart can no longer pump enough blood around the body to get oxygen where it's needed. And that's what's happening. Now, the most common form of heart disease is just caused by a leaky valve. Okay, and if it was you or I, we'd have valve replacement surgery, but that's just not possible in dogs. So our job as vets with these guys, and heart murmurs are really common, okay? And you're not gonna find a heart murmur at home, like unless you've got a stethoscope and you know what you're listening to. There's no point thinking, oh, I'm going to pick up my dog's heart disease because it's got a murmur. But I'm going to give you a couple of things here that you can look for. That if you're suspicious your dog has heart disease, or if you've seen your vet and they've said your dog has heart disease, but it's not quite bad enough yet, what you're looking for. Well, let me tell you what I want you to look for. So number one is, are they slowing down on walks? Okay, we got that covered. The second thing is, can you count their heartbeat? Okay, and the easy way to do that is just to put your hand right under on their sternum, on their chest bone, right between their elbows. And if your dog's on your lap right now, or your cat, do this, okay? Just put your hand right there and you'll feel the heart bumping away. Boom, 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 okay? Now, it can be a little bit hard to actually count, but the number we're always interested in, and you count it over 15 seconds, okay? So you just got to count the number of beats in 15 seconds. And we're looking for a number above 35 beats in 15 seconds, okay? So if you can count your dog's heartbeat and it feels like it's less than that, then that's probably not a heart problem we're going to get. We'll be interested, we want to classify it, and we want to make sure we know what's going on there, but we're probably not going to get excited about treating it just yet, okay? But maybe easier for you is this, okay? Just count the number of breaths at home. Now, a normal cat or a dog, and cats may breathe a little faster than dogs for this, but the number that most vets agree that is a problem for resting breathing rate is about 40 breaths in a minute. Okay, I had a gorgeous little puppy called Louis in tonight who had pneumonia. And when he came in with his pneumonia 4 weeks ago, his breathing rate was like, when he was rested and it wasn't bad, was about 60 breaths a minute. And when it got really bad, he was up as high as maybe 80, 90 breaths in a minute because he couldn't move air. He was trying to get oxygen in his lungs. Well, it's the same with heart disease. So if your dog pants at home, even though it's not hot, they've not been for a walk, they've just been resting, and that they're panting or their breathing rate's more than 40 in a minute, that's really, really suspicious for heart disease, okay? And that's how you tell it apart from dental disease. Or arthritis, okay? But just because your dog pants doesn't mean it definitely has heart disease. That's just a sign that you got to get something done about that and get that checked out, okay? So that's heart disease. Now, guys, I'm really conscious time's running along here. We're sort of 40 minutes into the webinar already, and I told you I could talk, right? I'm Scottish, so, and I'm worse than that. I'm from Glasgow, so I can talk heaps. So I'm going to get on to the final one. And then I'll tell you what I would recommend doing about it, and then we're going to do a bit of Q&A, okay? And I'll take as many questions as I can. I'm going to have to cut off at 8 o'clock, but I'll take as many questions as I can. So please keep your questions coming, and I'll scroll back through the chat box and go through them as we go through, okay? So, Cushing's disease. Now, some of you may not have heard of Cushing's disease, okay? It's probably less common than the other ones we've talked about so far, but it's the most common disease of the glands that dogs get. Okay, we call them endocrine diseases, but that just means diseases of the glands. And Cushing disease, I think, I put this picture up of a ticking time bomb because that's kind of what it is. It's by far the hardest of the ones we've talked about so far to diagnose as well. And the reason for that is it can just be really, really subtle. So Cushing's disease is kind of like the Scarlet Pimpernel of old dog diseases, but it's very, very common, okay? And it's more common in, again, the similar sort of breeds that maybe get heart disease, okay? So we see it quite a lot in Sydney. I probably see it more here than I saw in the dogs I looked after back in London. Because there's different dogs here to London. But what essentially Cushing's disease is, the best analogy I can give you is imagine driving your car around in third gear all the time. Okay, imagine you're like, I know you guys don't do like, you got automatics, okay? But imagine it got stuck in third gear. What that would do to the engine, like you would burn, like the engine would wear, you'd get through oil faster, you know, you'd be revving all the time, stuff would start breaking quicker. And it's kind of, that's what Cushing's disease is like. So what's happening is your body is producing too much steroid, okay? And your body needs a little steroid, okay? And we're not talking about the steroid that, you know, the gym bunnies have and they'll get all muscly. We're talking a different kind of steroid here. So this is the steroid that actually helps us wake up every day. It's our body clock. Steroids control our body clock. And they actually control how they make all of our cells do what they do. So when you've got too much of that kicking around your system, your cells start doing things that they shouldn't be doing and doing too much of it, okay? I've described this as like premature aging. And there's not a cell in the body Cushing's disease doesn't affect. So dogs that have Cushing's disease wind up losing muscle, their bones start to get a bit weaker, they get big pudgy pot bellies, but it's so subtle. And you know, when I graduated, you know, the first case of Cushing's disease I thought I diagnosed, I was over the moon because I thought, brilliant, I've managed to diagnose something. And I did the tests, and it wasn't Cushing's disease, okay? And what I've learned over the years is there's the way it's meant to present and show up, and if you Google it and you've got a dog with Cushing's disease, you'll scare yourself rigid Googling it because there's so many things can get affected, and I'm telling you, most dogs don't get everything wrong with them, so you shouldn't freak out if you've got a dog with Cushing's disease. But it's hard to pick up in a lot of cases because it's subtle. The classic things we're looking for with Cushing's disease are dogs that are super thirsty and super hungry. Like a dog that used to have good table manners, like you blink and it will steal the steak off your dinner plate. Obviously, that doesn't apply to Labradors that would steal the steak off your dinner plate, anyways. But you know that's what you're looking for: increased drinking, increased appetite. And sometimes, again, they just start to slow down. So Cushing's is on the list of 4 things because of that. Because they start slowing down, and because it's so subtle, and it can be a real tricky one to diagnose as well. It can be a very frustrating one for diagnosis. It can be a very frustrating one for treatment. But the difference in these guys, again, it's like, you know, I've had clients come back in and go, well, it's like you put them on a rocket ship or something, and they started, you know, they got all the energy back they used to have years ago. And again, typically this is a disease they'll live with for months, if not years, before diagnosis. Because what you got to understand about all of the conditions I'm describing tonight is they are not like broken legs. Okay, your dog breaks a leg. You bring it in, the dog's in pain, you touch it, it screams, it's really obvious to everyone. Hell, you don't even need to be a vet to diagnose that, okay? But these diseases are all much more subtle because they happen over periods of weeks, months, and frequently years. And it's just like watching grass grow syndrome. You know, you don't see it happening, you don't see it building up, and so it can take people by surprise. And it's one of those things that, again, with all of these conditions, because you see it a little bit every day, you don't recognize the change. And when you don't recognize the change, sometimes it's hard. You know, if you walk a marathon, it will take you a while, but you'll still have walked 26 miles, okay, one step at a time. And these diseases will take animals on similar journeys in a bad way into a bad place health-wise. It's just because they go there one step at a time, you don't notice. It becomes the normal situation for you as well. So when we fix them, that's why people get this big wake-up call, slap in the face moment. They go, oh my God, what happened? Why is my animal a puppy again? And it's not. It's just they wind up in, they go back to normal. They feel better. They recover their mojo or their vavavu. Okay, so Cushing's disease, you just look for increased drinking, increased eating, decreased energy levels, pot belly, or maybe they're just getting a ton of infections. They've not been a dog that has ever had problems with their skin and suddenly start getting a load of skin infections or something. You know, and the reason is their immune system's just getting worn down, so they're a little more prone to disease and illness. Okay, so that's Cushing's disease. Okay, and kind of the cool thing. This is a little sad, and it's kind of cool, but they're all kind of connected. So, you know, if I see an animal that has arthritis or heart disease, you know, an animal that's got one of these problems, the other is going to be affected. Okay, so if your pet has rotten teeth, well, that is going to make heart disease worse and potentially push your pet in a bad place with its heart. if your dog has Cushing's disease and rotten teeth and its immune system's all suppressed and screwed up, then the bacteria spilling into your dog's system are more able to do their damage and make disease happen faster. Okay? And then, look, the number one reason, the thing that holds, I would say certainly the two most common things, so the two common ones that we're talking about here, so rotten teeth and arthritis, can be traced back to, okay, breed, definitely. So some breeds get these problems more than others, but not just breed. It comes back to what you feed your pets, okay? And I know that like a lot of people feed like mushy, slushy, horrible processed foods, and they just are responsible for rotting teeth. And portion control is the other part of this. And what's in these diets to make them palatable is part of this. And these three things come together, and suddenly we've got these big numbers of pets that are overweight and have rotten teeth, and that's the modern challenge we face as pet owners and as vets. You know, if we'd have been having this conversation 20 or 30 years ago, well, we'd have been talking about vitamin deficiencies or rickets or things like that. Pet nutrition has come a long way, and so a lot of the health problems that used to be caused by diets are no longer caused. And that's a great thing. But now there's massive competition in the marketplace. Everyone's looking to sell you their food. And by the way, I'm not going to try and sell you food tonight. That's not the purpose of tonight's webinar. That's your decision. But I am saying, I'm sorry, someone's car is obviously getting broken into right outside here. So I hope you can still hear me. What I am saying is the choice of diet you make is going to have a massive bearing on your pet's general health. Okay. If you fix one of these things, that's the cool thing about how everything's connected. If you fix these things up, then everything starts to get better. Okay, so when you take care of the teeth, your pet's heart disease is going to get better. Cushing's disease isn't going to be so affected. When you remove an animal from pain, it just feels better about everything. So it's kind of neat that these things link together, and the body, you've just got to think of the body as a system, okay? And that's why thinking about the whole animal is really, really important. But I think, and I've changed my view on this over the years, I think the most important choice you're ever going to make for your pet is what you feed it, okay? And everyone's got their opinion on this, and tonight's webinar is definitely not to go in there, and I'm not going to open Pandora's box there and start, blasting you with my opinions on food. But the choices you make will definitely have that impact. And what we're trying to do with the practice is help people's pets to live for 2 or 3 years longer than would otherwise be the case. And I think if you choose the right diet and you don't let your pet get rotten teeth in the first instance and you keep it the right way, well, guess what? You're going to put most of us vets out of business, because a lot of the work we end up doing these days is fully connected to that, okay? So let's try and put us all out of business, because it's going to be better for your pets. That's the flip side of it. That's what we kind of want. Okay, so how do you prevent these issues? Well, number one, pay attention to what the universe is trying to tell you. If your pet's slowing down, that's a problem, okay? Animals are not built to slow down. Animals should remain happy, healthy, and kind of crazy and energetic way longer than we would expect them to. Pay attention to bad smells. Pay attention to limps, itches, scratches, bumps, lumps, all of these things. If something's happening, don't just dismiss it, okay? It's easy to do, but it winds up being a bad idea, okay? We need to drop bad assumptions about pet health as well. And one of those bad assumptions is what we've taken aim at tonight, and that is that pets slow down when they get to 6, 7, or 8 years old. It's just not true, okay? So let's put that one into touch right away. Get your pet examined at least once a year. And when they get to being an old animal, actually, if we did flip back to that aging curve, what you notice is as they get older, the years start spinning faster. Okay, so that's why pets, when they get above 8 years of age, it's a good idea to have them checked twice a year, because one of our years is kind of equivalent to around about 5 or 6 of theirs. And can you imagine not going to the dentist or doctor for 5 or 6 years? Can you imagine what would be going on in your body if that were the case? So twice a year physical examinations are actually a very sound investment for older pets, okay? Um, Blood and urine testing to me is an absolute no-brainer. There are things that, you walk in my consult room, I can examine your pet, I can get my stethoscope out, listen to its heart, I can poke and prod, but there are invisible things I can't tell you about your pet, and no vet can. We just don't have x-ray eyes. I wish we did. I wish it would make my life a lot easier, but you pick things up early, and if you do that, you get to deal with little things before they get to be big things, okay? And the final tip then is just take wellness seriously, okay? And that's what I've set up Dr. Dave's Vets and Pets to do, is really focus on wellness. So yeah, we can do the sick pet stuff, but that's not what we're trying to do. We're trying to avoid your pet getting sick in the first instance, prevention being better than cure. And there are basically 6 or 7 things that you need to do in order to keep your pet happy and healthy. So make sure you feed them a good quality and nutritious diet. Make sure you keep the portion control sensible, and you do not let them get overweight. Keep them vaccinated. Get them parasite control right for your area, wherever you are on planet Earth, and take advice from your vet from that. Keep their teeth clean. Make sure they're well trained and socialized. And then finally, if your pet has a little problem, deal with it when it's a little problem. Trust me, it'll cost you so much less. And it could cost you the ultimate sacrifice if you leave it too late. It's a sad thing, but some of these diseases, once they get to a certain stage, get past our help, okay? So that's kind of the headlines for the talk, okay? I want to, before we do the Q&A, I just want those of you that are local to hear, as a special offer, as a wee thank you for coming on tonight. We love our crusties, and if you are in the vicinity of a Dr. Dave's Vets and Pets, then this is just for you guys, okay? This isn't an offer that's going out around the rest of the practice or anything. This is just because you bothered to show up tonight, and that means you care about your pets and you know about this stuff. Well, I'd like to just offer this to you as well. So come in, have a health examination, have the blood and the urine test. We'll do a blood pressure test, and that's normally, I think it's around about 260, 270 to do, okay? Now, we'll keep this going till the end of July, and it will be 150 all in for all of that stuff, okay? And that's my wee thank you for coming in tonight, okay? And if you don't live near one of our clinics, or you're not one of my clients, I'm not going to ram this down your throat and railroad you to come in. We'd love to see you, but if you're not near here, then just go to your own vet, and it doesn't matter if it costs $250. Trust me, it's still a really good investment to do these 4 things for a senior pet. And you don't need to do blood and urine twice a year. There's just once a year, just a health exam twice a year is a great starting point, and then your vet can advise you from there. Okay, so there you go. We got 5 minutes left. Okay, so I'm gonna have a wee look in the chat box now, and I hope most of it's clean. So let me just zip back through and see if I can pick out some questions now, okay? And I apologize now if I can't get to them all, then it's not because I don't like you. I just ran out of time, okay? So there's some funny things here as well. Kylie, you're 40 and you Kylie says, I'm 40 and I've slowed down. And like, I'm not sure we can do these examinations on human beings, by the way. So, okay. So let's go through, and I've got some questions about dentistry happening here. Okay. So, okay, so Joanne, actually that's a good comment. So your girl has most of her teeth removed but still has sewer breath. Why does that happen? Okay, so that happens because the tartar and the bacteria and the plaque and all that gunk in the mouth, when you have it all cleaned off, it's all gone, okay? But it's just like us, okay? It's back within hours. The bacteria are not all completely gone. They're still there. They're going to multiply up and they're going to come back. So although you've had the painful bit taken away, the process that led to the painful bit can start coming back again. And that's why you got to brush the teeth every day, okay? Bones don't clean teeth, Okay, I've said it. I know that's going to set a firelight under some of you, but I have seen no evidence that that is the case. In fact, let me just tell you this about bones. I have a dog in my hospital right now that may or may not live because it got a bone that wedged in its esophagus, and we're fingers crossed, everything's crossed. It's not perforated its esophagus, and we've managed to remove it. It's doing well so far, and our fingers are crossed for this little critter. But there is not a bit of the intestinal tract I haven't taken bones out of. I have lost dogs because of bones. And I have had to take out more teeth than I really would like to mention because of bones. So bones don't clean teeth. If your dog has clean teeth and you're feeding it bones, it's because genetically it's probably one of those dogs that's lower risk of having the issue in the first place. Brush your pet's teeth. That will keep them clean, okay? And it will do it in a way that doesn't put your pet at any risk at all, okay? Kylie asked, my terrier had a knee replacement, so I expect he'll eventually get arthritis in that knee. I've been trying to give him glucosamine to try and help. So Kylie, what I would suggest is, yes, animals that have had surgery on arthritis will be at a higher risk of it further down the track. Glucosamine, the science isn't brilliant for that. But there's a diet made by Hills called JD, really high levels of EPA. I wasn't involved in the trials work, but I used it. I used to look after all the Metropolitan Police dogs back in London, so 300 odd dogs in their dog school. And we started using that diet on those guys, and about 80% of them, the ones that had arthritis, not just visibly improved, but got off of their meds. JD, to me, I think that diet's amazing. So, that would be my advice to you on that one. If you've got a dog with arthritis, ask your vet about JD. But the main thing for all of you with dogs with arthritis is weight control, okay? If you can get, just like my own family pet, if you can get your pet's weight down by like 10%, so if your dog's 10 kilos now, get a kilo off of it, watch the difference. That's how you'll turn it into a puppy or a kitten again, okay? Let me keep scrolling through the chat box here and get some good ones. Wow, that's a big question. Okay, so this is a brilliant question, and I can see like about 6 of you have asked this, okay? So Helen asks, what concerns should I make sure my vet is addressing for my 13, nearly 14 Maltese Shih Tzu cross who's going to need his teeth addressed shortly, okay? So, brilliant question. Thank you so much for asking it, Helen. I hear this. I see a lot of people bring old dogs to me and they say, I saw my vet 2 years ago and they said my dog was too old for dentistry, and so we didn't do it then. And now the dog's like 2 years older, has heart disease, has a mouth that it can no longer live with, and now we got to do something in a pet that's not in great shape. There are basically, I would suggest the first thing is a blood and a urine test are absolutely essential for any old dog undergoing anesthesia. So that's part one. Whenever an animal goes under anesthetics, we like to use, or you should use, like modern ultra-fast acting anesthetic agents that don't cause blood pressure drops. We want to make sure that they're on intravenous fluids throughout their procedures. We want to make sure that they are wrapped up snug as a bug in a warming blanket, because the old dogs lose heat fast, and that can be a big problem for them during and after in recovery. And then we want to make sure they get really good painkillers afterwards so they can start eating and they're comfortable fast, okay? Now, if your dog has a heart problem as well, then I would strongly advise you to get some chest x-rays and or an ultrasound done so you can find out how bad that problem is. And if your pet needs heart meds for a week or two first, then that's exactly what I would do. Okay, so I've been doing anesthetics for 15 years. I must do about 1,000 of them a year. And I have not lost an animal under anesthesia ever, okay? And I'm mega protective and proud of that record. And statistically, it's got to happen at some point, and I'll be devastated when it happens. But, I've gone 15 years in my career. I'm going to try and go another 15 years without that happening, okay? So what I've just described to you, we always do those things for our old dog anesthetics at Vets and Pets. And I think you have to work with a vet that's comfortable doing that. So a vet that wasn't comfortable 2 years ago doing that anesthetic's probably not your best bet for doing that anesthetic now. So I guess I mean, I think this is important with anything. You just got to be comfortable with your vet. Okay. So let me just I've got time. I'm going to take 2 more questions. Okay. So I'm going back up the top. Let's see. Okay, so my Dalmatian, this is from Susanna. My Dalmatian has arthritis, and while he's standing up, his butt starts going down, and he soon pulls it up. Why does he do this? Probably because, I mean, a lot of big dogs have arthritis of the spine as well. And what arthritis of the spine can do is just compress on the nerves, and so that just means that the impulses from the brain that normally go to the nerves aren't going there as efficiently or as fast as normal, and so the muscles can just be a little bit weaker because of that. So they can start to sink down, also because they can also have arthritis in the hips, and it's just a little uncomfortable. So they can shift round about a little bit. But I've seen quite a few Dalmatians. You see it in German Shepherds, Labradors, Retrievers. That happens a lot, actually, Susanna. That's not unusual. But it's obviously a sign of arthritis. And things like anti-inflammatories. We have a K-laser, which is a pretty cool treatment that can help with that sort of thing as well. But weight control is absolutely everything. Okay. So let me take one more question from you guys. I'm looking for a cat question. I know there's so many doggy lovers out there tonight. Okay, all right, Diana, you got a question. Diana, I'm going to take the last question from Diana and I say I'm taking a question I don't have a great answer for you. Okay, she says, how do you suggest the best way to have your dog brush their teeth when they're a bit snappy? Which sounds like glorious understatement to me, Diana. So that's hard, and I'm passionate about teeth, but I don't want you to end up in hospital because of your dog's or cat's teeth. Okay, that's not cool. If your dog or cat is not going to let you brush teeth, and some of them won't, okay? And especially if you're starting when they're age 15, that's going to be a hard ask, okay? Well, that's why once a year, I strongly recommend your pet have a short, light anesthetic to clean the tartar that's going to build up off of those teeth, okay? Here's how the conversation goes normally in a vet consult room. You go in, your pet has a little bit of tartar, and the vet says, oh, there's a little tartar there. And you go, oh, is that a problem? And the vet goes, no, it's okay. We'll see how it goes, and we'll check it out next year. Well, let me tell you how that goes. The tartar builds up, the infection gets worse, the dog starts to have a problem, and now next year, the dog needs extractions. Okay, totally, completely avoidable. Okay, extractions are expensive, they're painful. The disease, who knows how long it's been there since the last check? If we only check you once a year, then it may have been there for 6 months. Not a great approach. Far, far, far better to get in there, deal with the problem whilst it's a little problem. Scale the tartar off, and yeah, guys, I think people have to get used to the fact that to do dentistry right, that does need an annual scale and a polish. When we go to our dentist, how often? Every 6, 12 months. We brush our teeth twice a day, we floss, we've got a range of great oral healthcare products, and we still get them scaled and polished every 6 to 12 months, okay? Then we don't do any of that stuff in our dogs and are surprised that we need a scale and a polish once a year, or if we don't do that, that multiple extractions further down the track. Come on, let's get smarter about this, okay? Okay, listen, I think that I'm so pleased that you guys all joined me here tonight. It's a little weird to just be sat in a room talking to my computer, and I much prefer being in front of a live audience. But this is a nice way that you can all have a glass of wine, and I can speak to loads of you at the same time, and it doesn't inconvenience everybody. So it's been wonderful speaking with you tonight. Thank you so much for your comments. I'm sorry I couldn't get round and answer all of your questions. But you're always free to email me stuff. My email is Dave, D-A-V-E, at vetsandpets.com.au. So it's vetsandpets.com.au. And you're always more than welcome to come in and say hello at either of the practices in Darlinghurst or North Ryde. Okay. It's been great speaking to you all tonight. Thank you so much for attending. This is all being recorded and will be available on Listen Again, and we'll put stuff up on the website. If any of you do want to take us up on that special offer, then you can call Lauren or Jess or any of the guys on reception and book that in, and they will gladly help you out, and we would love to see you. But thanks for coming, guys. Have a great evening and good night.